And it's really a privilege for me to have with us here to kind of give kind of a summation of what we've been talking about today. This is a gentleman who's very appropriate to give the summation. He's a internationally known clinician scientist, so he treats glaucoma patients, and he does really incredible research in the field of glaucoma. How many people here have had an OCT done during the course scanning of the back of the eye, the optic nerve, as following up their glaucoma? That's kind of standard operating procedures now, and Dr. Schuman was the person who really developed that technology to be used for following glaucoma. So a huge impact in helping care for our patients. So Dr. Joel Schuman, who's going to close for us here, is the Kenneth L. Roper Endowed Chair and Vice Chair for Research Innovation at the Vickie and Jack Farber Vision Research Center at Wills Eye Hospital. He's co-director of the Glaucoma Service and professor of ophthalmology at Wills Eye Hospital. Let's welcome him.
Well, thank you very much. I really appreciate the opportunity to be here. I was unaware that marijuana was going to be served at the reception, so I'm sorry to be keeping you from that. But I will talk a little bit about the summation. So you've heard so many great talk over the last 2 days. And I need to recognize Tom Bruner. I know that he had to make a flight, but he's done a marvelous job leading the Glaucoma Research Foundation. I've had the opportunity to work with the Glaucoma Research Foundation for many years, even before Tom was involved. And the growth that the foundation has seen under his leadership has been tremendous. And it's really a patient-focused organization, in addition to providing funds for research to help identify new treatments, new diagnostics, and hopefully cures for glaucoma in the future. And Jay Katz, who is a longtime friend, and actually one of the reasons that I'm here in Philadelphia, is a wonderful moderator, and thank you for everything that you've done. What a great meeting that it has been. So we've heard from a number of speakers, really outstanding academics, patients, people who are in the audience, people who are going through what everybody in the audience is going through here, as well as a number of other points of view from different aspects of the folks that help to care for glaucoma. And I think that you heard about normal tension glaucoma, about the incredible importance of independence, how to deal with the diagnosis of glaucoma. You heard from Kristen Smedley, who gave a fantastic inspirational talk earlier today about glaucoma medications, about laser surgery, about some of the research that's going on, that's on the cutting edge, what may be coming down the road that will be interesting and beneficial for everyone with glaucoma, how to advocate for yourself and for your loved ones, and how to live with glaucoma. And I'm going to talk a little bit about some of those things and some of the things that are coming down the road in the next 10 minutes or so. So I don't have to tell you that glaucoma is common, that it is the leading cause of irreversible blindness, and that it's critical to detect the disease early and treat it early. And I think one of the things that's important is that we're learning new and better ways of identifying glaucoma, of identifying deterioration or worsening of the disease, and also we're learning how to predict who is going to have a problem in the future so that we can intervene now to help prevent those problems from occurring. And then finally, new ways of treating the disease, especially with regenerative medicine. Some of the work that Tom Johnson spoke about and other work in that field is really exciting. And the idea that we can either make the tissue that's there work better or actually cause new tissue to grow. So let's first talk about screening and genetics. We have technology now that we're able to use to image the back of the eye that is portable. So we can take a picture of the back of somebody's eye anywhere using a handheld device. And these handheld devices are able to use artificial intelligence to identify when things aren't normal. And so this is exciting because of the opportunity to reach people who cannot otherwise get care. And that's anywhere, whether it's here in Philadelphia, where we have a large population, it's a big city, we have a large population of people who aren't able to get care. They're in areas where care is scarce, or there's other things going on. They're not able to access the healthcare system. And we can reach out to those people and be able to diagnose eye disease, which they might not know about, or maybe they even do know about. Maybe they have symptoms, but haven't been able to enter the healthcare system or take advantage of it. It also will have implications globally. So there are many areas of the world where experts in ophthalmology or experts in glaucoma don't exist. And so being able to use a device that images the back of the eye and then can use artificial intelligence to say whether or not there's an abnormality will be a whole game changer because it'll allow those people to be identified and treated. We're also seeing new and better ways of testing visual function. I did not hear one person up here answer Jay's question about loving visual field, where anyone said, yes, please give me another visual field test. And I have never had a patient. Actually, that's not true. I had one patient who asked to have more visual field tests. But this, I think, is going to change how we do visual field testing. And what I mean by that is by using virtual reality perimetry, there are a couple of things that we can do. One is that we can get more information over time. Let's say that you're able to do this at home. I'm not sure that it's something that you would choose to do at home if you didn't have to, but it'll allow us to reduce the variability that exists in these tests so that we can more accurately say whether or not things are stable or whether or not we need to intervene. And so virtual reality visual field testing, I think, is an exciting new opportunity for us. Genetics are changing the way that we're able to identify people who have glaucoma, to understand the disease itself, and to identify glaucoma in people before they actually have the disease or any manifestations of the disease that we can detect. So there are a number of genes that are responsible for glaucoma in most people who have the disease. And by looking at the kind of swath of different genes where there might be abnormalities, we can produce something called a polygenic risk score. In other words, how many genes are there abnormalities in? What does that mean if you add that all up together in terms of somebody's likelihood of developing glaucoma, and in particular of developing bad glaucoma? And so this polygenic risk score is something that you'll hear more about with time, and it's a very important new way of using genetics in order to identify disease and take care of people. In terms of diagnostics, Jay mentioned optical coherence tomography. This is a technology that I was fortunate to be involved in inventing, and it has become something that is being used throughout the world for a variety of different types of eye diseases, but not just eye disease, also other medical problems, in addition to being used in industry, even in the art world. So when you see those pictures where they're looking beneath the surface of an artwork to see what the artist had done before using infrared, this is one of the ways that you can look beneath the paint. Now we have new types of OCT, and there'll be newer types coming down the road. And there are even types of OCT where we're able to look at the blood vessels within the eye. Can you play that? Are you able to click on that and just play the video, or is that just not playing? Okay, not important. What I'm showing you now is that we can use OCT not just to look at the tissue itself, but we can look at the blood vessels. So how many people have had something called fluorescein angiography? Anybody? Where you get an injection and they take pictures? That's amazing, because 15 years ago it would have been a much different answer. Fluorescein angiography was the standard for looking at the blood vessels in the back of the eye. Now we can use OCT, non-invasive, quick, non-contact, safe, and we can map out the blood vessels better than we ever could before without doing anything, giving you any exogenous medicine or drug. And so we can look at these blood vessels and they tell us about what's going on in the optic nerve and in the retina. And we're learning how to use this in terms of identifying glaucoma progression, so deterioration in people with glaucoma, in ways where we could not identify that progression any other way. And then we're also able to use different wavelengths of light so that we can measure the amount of oxygen in those blood vessels. And so that tells us how well the tissues are working. And we can also look with very high resolution and see layers within layers of the retina that allow us to make better diagnosis and earlier diagnosis. This is one of the ways that we're using optical coherence tomography, OCT, to measure change over time, and it corresponds to abnormalities in that visual field test that we were talking about before. So we can use statistics to tell whether or not somebody is getting worse. So those red lines that you're seeing on the screen are areas where the tissue is deteriorating, and we can then know there's something going on here. We need to intervene in order to stop the deterioration. And we can also use different aspects of these scans in order to make better diagnoses and to better predict who is going to need more intensive care. In terms of drugs and treatment, you heard about the LIGHT study, which supports the early use of selective laser trabeculoplasty. So laser for glaucoma is now typically first-line therapy for many people. This is it's a paradigm shift from 25 years ago. This is an exciting thing, because in many people, we can do SLT laser, and that may be all you need in order to control your glaucoma. On the other hand, many people need more than just the SLT laser. So it is a safe and effective treatment. And you can think of it sort of like giving the effect of one type of glaucoma drop. This is what you're looking at on the screen is an advanced version of the SLT laser. This is the direct SLT. And with this type of SLT laser, you don't need the level of skill to do the treatment that we do when we're doing the SLT laser these days. So this does it without using a contact lens. It has eye tracking, and it does the entire treatment in about 2 seconds, about 2 seconds per eye. There are new kinds of drugs that we're using now. Vyzulta, some of you may be using Vyzulta now. It's a combination drop that became available a couple of years ago. Iusa, which is a new formulation of latanoprost that does not have preservative. Rocklatan, which is a combination of latanoprost and Ropressa that also became available a couple of years ago. And then extended release implants. So there's Durista that you heard about earlier, as well as the iDose implant. We heard about the use of vitamin B3 a little bit earlier from Tom Johnson and also from Pradeep Ramalu. This nicotinamide is vitamin B3. This is some very exciting work coming out of Columbia University as well as some other centers. And the idea that we can use vitamins essentially to help to protect the optic nerve in addition to pressure control, I think is a whole new area that people are very excited about. And so this allows us to attack the problem in a different way than just controlling the eye pressure. Surgical treatments, we're seeing more and more in terms of new surgeries for glaucoma. You heard about the different types of operations, about the microinvasive or minimally invasive glaucoma surgeries. The minimally invasive tend not to lower the eye pressure as much as the standard or gold standard types of glaucoma operations, like trabeculectomy or glaucoma drainage implant, but they have less risk than those other procedures as well. And for some people, the microinvasive is all you need. And then finally, regenerative medicine. You heard about the work that Tom Johnson is doing in terms of regenerating the optic nerve by implanting retinal cells that turn into retinal ganglion cells. And we're learning more and more about that. The vision restoration initiatives from the Glaucoma Research Foundation with the Catalyst for Cure 3 are producing exciting results. The use of stem cells, in particular adipose-derived stem cells, is something that my group and a consortium that we put together is looking at to regenerate the trabecular meshwork. So the idea there is to try to cure glaucoma, high pressure in glaucoma, by using stem cells to bring the trabecular meshwork back to life by restoring the structure and the function of that tissue. And so far, it works in mice. And so if you're a mouse with glaucoma, no problem, we've got it covered. But we're hoping to do a first human study within the next few years. And then there are a number of different ways of attacking this problem, either by using a person's own cells or by creating new cells, what's called induced pluripotential stem cells. To summarize, there have been a number of different studies that have looked at the problem of regeneration in the eye, and I think that we're on the cusp of actually seeing these techniques applied to people in the next few years. So to end things up, we're seeing new advances across the board in terms of glaucoma diagnostics and glaucoma care. We're improving our ability to detect disease, to treat disease. Regenerative medicine is starting to mature in the eye, and it's really your support that helps to make these advances happen through the philanthropic support as well as your tax dollars. A lot of these studies are funded by the NIH and other federal mechanisms. We're constantly trying to push the field forward. And that's one reason why funding things like Catalyst for a Cure and Glaucoma Research Foundation is so important in driving innovation. Thank you very much.